Well, this couple visited me from Nashik, and when I was going through their investigations, I found that he was having two semen reports of oligospermia. Both the time the sperm count, once the sperm count has been 8 million, and the next time the sperm count has been 6 million. And both the reports were done at about a month's interval. And I looked at, and those reports were about 8 months old. And he was reluctant to repeat it again, and he was all set that, doctor, with such a low count, I've been told IVF, and I'm all willing to go for IVF, and we'll just plan an IVF treatment. I said, fine, even if you're willing for an IVF, as a protocol, allow me to do a repeat sperm count in my own laboratory, because we use computerized semen analyzer machines, and all the motility count, everything is done at about 37-degree temperature, and that would be very optimal to know the results of you. And he said, well, I'll give a semen sample. And I generally don't take an abstinence period of 2 to 7 days. I'm okay with an abstinence of 1 day, because that's an ideal time, because less the sperms spend their time in epididymis, better they are. So I said, if you have 1 day abstinence, let's give a semen sample today. Within 40 minutes, the report will be there, and we can have a word again with each other. And after about 1 hour, when they walked in, it was a nice report of 64 million count with 2 ml semen, and everything was all normal. All the parameters, semen parameters are normal. And he said, doctor, how can this happen? I said, well, there is something called temporary oligospermia, and that's why the ASRM, or the American Urological Association guidelines, is that you should be repeating the counts. And you should give a thorough history when you do a semen analysis. Whether you had a viral fever earlier, did you suffer from COVID earlier, or did you have a bout of alcoholism, or maybe your sugars went bad, did you have a lot of stress where you not slept for about 8-10 nights, viral fevers, any accident, any fractures, long time antibiotic therapies, all that can lead to oligospermia. But these oligospermias are temporary oligospermia. And there is a variation in sperm count, an individual variation in the sperm count from day-to-day variation. There's a beautiful study done in UK, wherein they have gone every week, one sperm count was analyzed, about 52 samples were taken all through the year, and they had as low as 18 million to as high as 160 million. So this kind of a variation is commonly seen. So having just 1 or 2 reports of saying oligospermia, don't get disheartened. Many a times this could be a temporary oligospermia, and you evaluating it again and going further could be of great help. Thank you.